Stroke or acute brain attack is an abrupt onset of neurological symptoms varying from weakness, slurred speech, loss of balance, giddiness. There is a useful acronym, FAST, to be able to quickly remember and recognize the signs and symptoms of stroke: facial weakness, arm or limb weakness, slurred speech, and T in that acronym stands for time because time is of essence. There are basically two types of stroke: ischemic stroke, which is because of impaired blood supply to the brain, a clot or a narrowed artery blocking blood supply, and the second type of stroke is a hemorrhagic stroke, which is because of bleeding into the brain. Both of these can look quite similar at the onset but have varying different treatments.
Although stroke is a problem of elderly population, almost 10 to 15% of stroke do occur in young population between 18 to 50 years of age. Traditional risk factors like hypertension, diabetes, dyslipidemia, smoking, obesity, nowadays these are increasingly common and causing stroke in young population. We do get lot of cardiac issues like rheumatic heart disease, other war-related problem, rhythm disorders causing stroke in young population.
Stroke, or the hand of God, is a medical emergency that can cause permanent disability. The golden hour management, with its recent advances, can really make a difference with getting back to a fully normal life versus having a life dependent on others. Each and every one of us should be able to recognize the symptoms of stroke, and we need to rush our near and dear ones to a stroke-ready hospital where immediate management could make all the difference to a better outcome.
Once the patient comes to the intensive care unit, that is ICU, after receiving the primary treatment in the emergency room, we monitor the basic parameters like pulse, blood pressure, and the oxygen level. The important thing what we need to monitor after the stroke in the ICU is a neurological condition and the ability of the patient to protect his or her own airway. And at any point of time there is a significant deterioration, what we do the imaging of the brain like MRI or CT scan of the brain. To know what is happening in the brain, sometimes we do the EEG. The primary aim to keep the patient in the ICU for neurological monitoring is to prevent the secondary damage like hypotension and convulsion, and we plan the things accordingly.
Neurorehabilitation plays an important role in the recovery from stroke. Many stroke patients continue to have weakness of one side of the body, difficulties in speaking, difficulty in swallowing, and memory problems. Neurorehabilitation is a team effort comprising of rehabilitation physicians, neuro-occupational and physical therapists, speech and language therapists, and cognitive therapists. At Apollo Hospital, this team, together with using sophisticated robotic devices, helps stroke patients make a complete recovery from the effects of stroke.